So welcome back to At the Farm Gate. I'm Jack Hughes, and in this special follow-on episode where we're revisiting insights from our recent webinar with Richard Hepple to dig a little deeper into his expertise and experience in managing disease risks on farms. I'm joined by Richard from APHA, a veterinary epidemiologist and expert in exotic and notifiable diseases, with decades of field experience investigating outbreaks from avian influenza to foot and mouth. Richard shares insights on how disease enters farms, the risks of co-grazing, and the practical measures that can make all the difference when outbreaks strike. With disease pressure high and preparedness and more important than ever, this episode is packed with expert advice to help farmers stay one step ahead. So let's dive in. So welcome, Richard. Welcome to the podcast.
Okay, thanks for inviting me.
No problem at all, and thank you for the recent webinar as well. So, Richard, just to kick things off for the audience, could you tell us a little bit about your role with APHA?
Yes, so having done approximately 10 and a half years in mixed practice as a vet in general practice, I then became involved in 2001 with the then Ministry of Agriculture as was. Went through 2001 doing a variety of field activities in terms of FMD control. I then ended up joining the service, did a stint as a field veterinary officer up in the Newcastle office, then moved into a sort of field policy liaison role. And along the way, I developed a strong interest in epidemiology, joined the field epi team, ultimately ended up being the lead for exotics within that team. So I've dealt with, as you mentioned, foot and mouth twice now, blue tongue twice, a variety of other diseases, and basically been working on avian influenza since the Celodike swan in 2005, HIPATH, and most of the outbreaks in between. Currently, I'm in a temporary role leading the APHA exotics team as well. So yes, I'm a veterinary epidemiologist. In that role, normally I am responsible for leading a team of people, coordinating investigations into epidemiological investigations into confirmed cases of HIPATH in this circumstance. And we're looking to investigate how we think disease may have got onto the farm, how it may have spread around the farm, and how it may have spread off the farm, if that is the case, and trying to identify any areas for improvement in terms of biosecurity. As part of that, I've done a lot of work with industry in general, and we put together a photo library of good and less good examples of biosecurity from actual cases. And well, not all of the photos, I'll hasten to add, not all of the good ones are from unaffected premises and vice versa. So there is a mix in there, but it's a lot of the common things and some hopefully good examples that people could consider when looking at their own premises.
That's great. Thanks, Richard, for introducing yourself there. And you've obviously had a varied role there and high in your expertise. And as you say, the book that's available to show the good and the bad. I mean, that's available for everybody to see, and it is well worth a look. So just to dive in there a little bit, I mean, from your perspective and what you've seen being out in the field, what would you say are the highest risk routes for disease entering into farms?
Well, I think the main thing at the end of the day, I mean, it's less clear cut, obviously, if you've got free range birds, because you can't entirely prevent contact with wild birds, but certainly if birds are housed in those systems, the crucial point, well, even if you've got free range birds that are housed overnight, it's the entry into the houses is the one thing you can control, the measures you take to actually enter that house. And we within the epi team, we think of that as the hard inner shell. So we've got the variety of areas working in from the outside of the farm, so you can't control whatever's happening on the main road or outside the farm, but you can start to have elements of control, obviously, from the boundary to stop unauthorized access. Moving in, precautions you can take when you've got say feed deliveries, egg collections, other visitors coming into the general yard areas, and then finally entering into the poultry accommodation, which is the biggest area to focus on, really. So it's making sure the areas around the houses are clean. We don't want overgrown vegetation, scrap rubbish lying around, anything that could attract wild birds and vermin in particular. You want to minimize that as far as possible. Bedding management is a big thing that we found as a common factor. I mean, these are multiple pathways, and you can't always say it's one particular pathway that's led to disease getting into that shed. But bedding management is high on the list, particularly for people who, if they don't have a building to store it and it's stored outside. Obviously, a lot of what we see is double wrap bedding delivered on a pallet. If that's the case, once the outer wrapper is breached, need to make sure that anything you're taking in, so a wrapped bale, is intact. If there's any damage to it whatsoever, that could be contaminated. Water could have washed virus into there. Those should be disregarded, not used for the poultry. And then again, with the intact bales, making sure they're properly disinfected on the outside before you walk in. Otherwise, you can dip your boots, but if you're carrying something that isn't disinfected, that's bypassing the system. We've talked about entry to the bird areas, really trying to consider as far as possible, ideally having completely separate footwear and overalls, outer clothing for work outside the house compared to work inside the house, changing those and having a very defined sort of hygiene barrier, ideally something like a swing over sit on, so you're not struggling to change your boots as you're going over, and then be able to get into the new clothing before you go into the bird areas, and vice versa. Again, ideally color coded, so it's very obvious what is for outside and what is for inside use. Building maintenance still comes up as a fairly common problem. Gaps in the structure, which can allow rodents in. Obviously, there's a lot of work and advice being given about meshing ventilation inlets, outlets, any gaps, to try and prevent the access of wild birds, particularly small wild birds. At the moment, we don't know the full significance of small passerines, so small perching birds, sparrows, robins, things like that. But we do know they can be susceptible. We have had positives that we've detected, and those are the type of birds that are more likely to be able to get into housing through a very small gap as compared to, say, a seagull. Structure of the house, other than any defects under doors, we've seen problems with houses that have got roller shutters at the back for moving in and out. We've had those where they're not coming flush to the ground, so again they can allow rodents access. Similarly, any flood water can similarly enter, and that can wash virus into the house, so that those are areas. And then again, the structure of the roof, we've seen quite a lot of places where the first affected birds have been under an area where we've seen water ingress leaking or running down the walls. And again, as part of that, making sure the outer guttering and everything is clear, water is getting drained, any roof water is getting drained well away from the building, so that there's no chance of it overflowing and leaking in through holes or coming in under gaps. So flooding in general, we've covered that. And then again, vermin control, very important. We've known for years the significance of rodents in salmonella transmission. In that case, the rodent themselves can become infected and shed the salmonella. Recently, we have been interested in looking at rodents on infected premises, and we had a number through. Most recently, we've had a mouse where we did actually get positive results. So there was virus detected on the fur and the feet. There was also weak virus detection on swabs taken from each end, so from the mouth and the rectum. But most crucially, there was no sign of a productive infection in the mouse. So there was no virus in the inside tissues, particularly the brain, which would be a target area for high path. So we can't make any assumptions that the mouse or a rodent is actually shedding the virus actively itself, rather than just being contaminated on the external surfaces by being in a contaminated environment. But then effectively they can enter the house and they can act in the same way as a dirty boot would. So fomite spread on the surface of of the rodent rather than it actively shedding the virus itself. But once they're in the house, then they can be exposed to the birds. And this virus is highly infectious. It takes very small amounts to infect a bird, and it only takes one bird being infected that will then amplify the virus and then rapidly spread it to others. What we have seen, particularly in the galliform species, chickens and turkeys, virus gets in, you might get one or two birds dying or showing signs early on, but over a matter of days, that ramps up almost exponentially. So you can go from 2 to 8 to 20 to 70 to then thousands. And it, particularly in turkeys, you'll see really, really rapid progression like that. Not quite the same necessarily in species like ducks, where the signs may be more subtle, although we have seen clinical disease in older ducks. And certainly younger, like ducklings, recently placed ducklings, they can be highly susceptible, and you will see a similar pattern. So those probably are the major things. And again, it's things like keeping visitors and deliveries and everything coming into the perimeter, keep those to an absolute minimum required. So you're trying to reduce that overall footfall. But most crucially, it's anything going into the buildings is the major risk.
Yeah, thanks, Larry. I mean, very, very informative, and I think it reiterates a lot of what we say to the industry as well, that a lot of this is under the control. Unfortunately, if you are free range and the birds are ranging, we do lose that bit of control. But most of what you've raised there is under the control of the producer. The maintenance, the vermin control, although vermin will get unfortunately where water can't sometimes, and they will make their way in. But for listeners to understand that vermin can potentially play a part in this is a big thing. And I think you touched a little bit there on, the susceptibility of turkeys. And, is avian influenza changing? And you're the expert in this field. And why does it cause so much problems in the turkeys?
I wouldn't necessarily want to say that it is changing per se significantly. We're seeing similar patterns. Obviously, past years we've had much higher number of cases, and then we've had a year with relatively few, and then this year has been sort of in between. I wouldn't necessarily say the virus itself is changing, but as mentioned, those galliform species, chickens, and we have seen quite a number in laying hens as well, and not all of them free range. A lot of them are being housed. I think it's important to remember as well that housing is one biosecurity measure on top of a load of others, but housing is not a silver bullet. So just because the birds are housed doesn't mean you can ease off other things. You still need to do all the other layers. I see biosecurity as a stepwise process, and everything you can mitigate against, be it changing your overalls, having foot dips there, changing boots in between, your vermin control, building maintenance, all of that, everything you can address is taking a few points off your sort of risk levels.
Yep.
And yeah, the galliform species are most susceptible to it. And the figures I quoted before with that exponential mortality, we see that regularly in chickens and turkeys.
Yeah, I like how you say that there, Richard, about housing not being the silver bullet. Unfortunately, we do think, and as important as the housing order is for the free range sector, it is only the start. It is only, we do have people still moving in and out of them sheds and taking bedding in and that movement around. So the housing is only the start of the measures that need to be built up on top of that. And I think that leads nicely into
these are the measures, even if you haven't got a compulsory housing order. I think the other biosecurity measures need to be in place, to try and reduce your risk before it actually occurs, rather than it, putting them in once we know there's disease in the area is the horse is probably bolted. Then they need to be measures that become a routine, and they may be tiresome, but trying to get them in place so they become a normal behavior automatic. You're not thinking that you're doing them is the key to it. So again, design of, if you've got step over areas, designing those in such a way that there's enough space that the staff can comfortably change their clothing and their boots as they need to do without struggling, bending over and anything like that, keeping those areas very clean and very clearly segregated from a dirty area going into a clean area and taking the appropriate measures in between. The other thing as well, I just mentioned as well with premises where they've potentially got workers who maybe their first language isn't English, very, very important to ensure that they fully understand what they should be doing and why they should be doing it. So it's clearly spelled out and ideally demonstrated to them by somebody with overall charge and control of biosecurity, because it's all very well, you can have a great contingency plan and standard operating procedures, but at the end of the day, if the staff who are there 24/7 or dealing with the birds on a daily basis, if they don't fully understand why they need to do all of this, it maybe loses some of that effectiveness.
No, 100% agree with that, Richard. And as an industry and with biosecurity, we see it as heightening biosecurity during heightened pressure times. But I think the more we understand how much biosecurity can actually help with overall production throughout a year, and it becomes a routine as simple as putting your shoes on in the morning to go and have a walk, people will embrace it, and it just becomes part of that day-to-day workload. And I think that leads nicely into one of the questions that came from the webinar for yourself, which was where should the industry be more ambitious in biosecurity and preparedness?
I think a number of those measures that we've already discussed, and I think one of the simplest things that could be put in at relatively low cost is that having dedicated footwear for inside and outside and dedicated overalls, so you're minimizing that. Have good hand washing facilities inside, hand sanitization, so once you're into that area you are as clean as you can be. I mean, no premises is ever going to be 100% biosecure, everyone realizes that, but it is a case of doing everything you can to minimize the risk of virus getting into the house and into those birds. Again, I think as we're coming up, I think we're maybe going to touch on it shortly, but hoping that things are starting to quieten down as we get into warmer weather, drier, more ultraviolet light, hopefully less virus survival in the environment. An ideal chance, hopefully then, for keepers to be properly assessing their biosecurity, have a good look at the housing, the structure, the integrity of it, anything that they can think about introducing. I mean, having external people coming in as a second pair of eyes, I think, is very good. Obviously, we're all human. When we're in our normal working environment, we accept things as being there, and it may be we're not seeing an obvious problem because we're used to it all year round. And a second pair of eyes coming in is very helpful to try and point those things out, areas that you may not have considered, but where you could make a fairly small change to improve the effectiveness of the biosecurity.
Yeah, I think you're right there, Richard. By bringing in a third-party company or even your vets as well to really to give that second pair of eyes. As you say, we're all human. We will walk past something and say, "Well, I'll do it tomorrow," but tomorrow becomes next week, and next week becomes we'll do it at the end of the flock. But them small maintenance measures might just be the one thing what allows this virus to get in. And
I mean, the other point with that, there's been a lot of interest in meshing around buildings for vents and intake outlets, intakes and outtakes. There had been a lot of interest from industry about that. We have worked with them. Again, it's an idea. There are recently updated guidelines about the meshing, and there are certain derogations now for people who may have meshed in good faith, but maybe the mesh they were supplied with wasn't sufficient to meet the requirements, particularly if they need a license to move. There's a biosecurity assessment by their own vet to support that. There are some derogations now. Speak to the private vet about it. If you haven't meshed, there are guidelines on when that needs to be done by, depending on the production type. But again, over the summer when it's not pouring with rain and whatever, that's an ideal time to try and put those remedial measures in place if they're not already. And as I mentioned, it's trying that as hard as we can to stop small birds, and even things like feathers to an extent. I mean, the meshing, my advice is that the narrower the meshing you can get away with. We appreciate it can cause problems with dust buildup, fully take that on board, but the smaller you can get away with that's practically within your system, the better, to try and stop those small birds getting in. We have got ornithological advice with some systems we've looked at where you've got, so the guidance is a minimum of 25 by 25. We know some people they've gone in good faith to source it, and their supplier has given them something which is 25 by say 35 or something like that. These small birds will get through that quite easily. And if once they're inside, if they are infected, they can potentially deliver virus on top of the birds. They may be only small, but they're targeting it rather than just contaminating the wider environment outside for people to walk it in. And some of these systems we've seen they've had grids which are 20 by 60, but we've got advice that small birds like that, sparrows, blue tits, robins, things like that, will easily exploit that. It's not just the one dimension, it's both dimensions. So if it's longer one way but shorter the other, they can still get in because of the way they can sort of contort themselves. And obviously in poorer weather, they may be more looking to go inside in search of food, or get out of the way of storms, etc., like that.
We do see that often on farms where especially in the overlapping ventilation inlets where the building actually comes over and the air's pulled underneath, is where they'll get under there and get up on the stanchions.
We've had cases where there's actually been nests, they've been nesting there because it's nicely protected undercover.
Yeah. No, really appreciate that guidance, and for everybody involved, 25 by 25 is the minimum set out there by the government. So hope everybody is working towards that. They're just stepping away from buildings and structures and routes of entry into the sheds a little bit. One of the big questions, obviously, in the industry, and which has been happening around the world, unfortunately, what is the risk associated with co-grazing or mixed species setups? In some cases, where we're grazing, particularly lactating animals on the range areas and free range sheds.
Yeah, well, we've obviously taken more of an interest since, in terms of mammals in general. We always had to sample pigs on any confirmed avian influenza premises. That's been in a legal requirement, international legal requirement, for years and years. But obviously now we've been looking a lot more closely with events in the United States, where they've obviously had a lot of problems with high path getting into dairy cows and then moving, because they got long distance movements over there, so it's spread. I think pretty much all of the states have had a problem at some point over the last year or two. Very important to bear in mind, though, that the virus in the States is different to the virus that's circulating both here and in continental Europe nearby. So that's an important difference. We've had in the testing, so what happens now, if there are co-grazing mammals on a confirmed premises, the field epidemiology team will do a detailed risk assessment looking at all the potential contact pathways between the birds and the mammals to see if there's a risk. If that's can't be ruled out, then we will request some sampling of those mammals. For the current season, I've got the figures here, most recent ones, 253 mammals, but that's a variety, obviously pigs, but quite a few cattle and sheep. We've done some goats, some alpacas, some horses and donkeys, some ferrets, and 2 cats. So far, we haven't found any positives. We did have a positive in a sheep a couple of years ago. That was a lactating animal. It had been, essentially, the birds there had been free ranging and the sheep had been with them. That particular animal, it ended up being humanely culled, and we did extensive tissue sampling of it. We found disease in the udder, but nowhere else. And I say that is, and then we retested the rest of the sheep, and there was no further detection. So that was a one-off, hopefully. Obviously, a couple of years ago, we did a anonymized bulk milk survey of cattle, and we found nothing. There are plans that may maybe be repeated just to keep an eye on things. There's no indication that it is going to get into mammals. We've obviously seen it in spillover into mammals all around the world. Foxes, seals, things like that, otters. But again, they're animals that are most likely be either preying on or scavenging dead wild birds that could be infected. So there's an obvious massive exposure to infected birds in those cases. Most recently, we've had detection of antibodies in a cow in the Netherlands. That arose because a cat on the infected premises got sick, was tested for HIPATH, was positive, subsequently died. So the Dutch authorities then tested some of the cattle, found a positive in one animal. They then tested the rest of the herd and found another 4. But again, it was only antibodies. The first animal had some signs that could have been consistent, so mastitis and a bit off color, but we can't necessarily link them. But there was no evidence of active viral infection within the animals themselves, and no indication of spread anywhere else. So I think that is more of an incidental finding. Lactating mammals, probably more of a potential risk, particularly if they're lying down in a contaminated environment, and any contamination can travel up, if they're lactating, up the teat canal into the udder, and the udder has receptors that can support the virus. But to date, we've got no indication with anything we've tested that there's any particular adaptations to infecting mammals over and above the odd spillover event that we've seen. But it is obviously something to keep an eye on. And if you are co-grazing, then obviously the potential risks there that we might have to do some sampling, which is obviously not, it's a bit of a disruption. The other thing really is, as far as possible, if you can have separate staff looking after the birds and the mammals and separate equipment, so they're not crossing over, you're trying to minimize any direct pathways between or indirect pathways between the birds and the mammals. That can all help. So there's no indication at the moment that it's going to be a particular problem in mammals. We've got no evidence for that over here. And we've got the same predominant virus strain as they have on the near continent.
That's very informative. I mean, one of the questions from the webinar, and I think you've answered it throughout there, was, is avian influenza detection in mammals likely to continue, and how might this affect biosecurity on mixed animal farms? And I think you've answered that in its entirety through that.
Well, as I say, we've got no major indicators that we're particularly worried, but we're obviously keeping a very close eye on it, so that if anything does change, we'll pick it up straight away. But as I say, no evidence, no indications at the moment to be of huge concern. But it is something to bear in mind, because if that event did happen, it's obviously got a lot of repercussions.
Yeah, of course. So coming away again, from your point of view and being out in the field and having teams out in the field, how does disease impact outcomes differ between farms that have clear plans, proactive plans in preparedness for this, versus those who are just reacting to the crisis in its entirety?
Well, I think with that, obviously planning ahead, I mean, you never know when it's going to happen. So having clear plans, well, for 2 scenarios that I'll take. One is the worst happens and you become a confirmed case. Or if you report it and you initially go under restrictions while the samples are getting taken and processed, it's sort of thinking ahead. And at the time, because you'll be under restrictions, but do you have an urgent feed delivery that's needed? So think about that, mention it to the case vet, because they can probably do a license to allow that under certain conditions. So you're looking after the welfare of the birds till we have an outcome. Again, and something highly crucial really for the field epi team when we're investigating these things is having really good records, a really good visitor book. Legible is the main thing. A lot of the ones we see, it's very hard to make out names, phone numbers, anything. So it's having that full record of who's been there for why, what, their company, their contact details, whatever. so that if that visit is within the high risk period, our tracings team can follow that up immediately. Similarly to that is having, being able to have production records, and we really want production records. Particularly, we're looking at mortalities, but we will consider feed, water consumption, egg production where that's appropriate. Mortalities, particularly for galliforms, is one of the key things. That's your earlier sign before you'll necessarily see any egg drop or other changes in parameters. But having those, and we really need those kept on a daily basis, because that can help us really try and tighten down the most likely date of infection. Some places we've had the records, they've kept them on a whiteboard in the house. At the end of the week, they send all of that to the head office, and then they wipe it, and we're only getting a weekly aggregated figure, and that is fine for monitoring production, but it's not really very helpful when we're trying to define a tight time window, so we're not tracing anything that we don't have to trace. And keeping feed invoices, egg collection tickets, all of that, having that available. So if asked for, our vet can give you a time period and you can instantly provide that. We can take photographs or copies or whatever. That will go to the epi team, and that will hugely help them in tracing source and spread of disease to try and rapidly get on it and contain it. I mean, I will say from now that throughout the outbreaks, we've seen very limited premises to premises transmission. Really, it's been a very small number of cases, potentially predominantly linked to shared staff or shared equipment, but that on the whole, hopefully that message has got out, and people are keeping different parts of the business separate. Again, thinking ahead, and I know it's difficult because it's a lot of investment, but it's not ideal really having an egg packing center on a premises with birds as well, because if one goes down, the other's going to be subject to restrictions. It can interrupt the flow of the normal business. We've had that on a number of occasions. Similarly with hatcheries and things like that, trying to separate out different kind of infrastructure within the business to try and keep them as separate as possible, so that they don't necessarily all get dragged in.
Yeah, no, I think you're right there in that contingency.
And again, if you're in a scenario where you haven't got disease, but you fall into a protection surveillance zone, again, it's thinking ahead what routine events are likely to occur. You obviously you won't know till you're in a zone that you need to think about a license, but it's having that planning ahead. So as soon as it happens, you're thinking, get license applications in as early as possible so that they can get processed quickly, and ideally you'll have the license for the time that you need it for your egg collections or your feed deliveries or whatever else you need to do. It is that real planning ahead to try and minimize the impact and the being worried whether you're going to get a license in time or not.
Yeah, I think you're right there, Richard. Being proactive is always better than being reactive.
Absolutely,
and
yeah.
As we've seen, unfortunately, this season, with big units going down and tying other businesses in with there, it's not just the effect that it has on that business, which is it's a terrible time, but it's also the wider supply chain and that business continuity of all other businesses, what are either being supplied or supplying into such farms. So I'm 100% behind the reactive, the proactive measures that need to be put in place and plans, and touching a lot of wood here, but hopefully planning for something what never happens. But it's like having an insurance policy out there what you hopefully never need to use.
Yeah, absolutely.
So just before we finish off now, and it's one of the questions on everybody's lips, one of the main questions I get asked on a daily basis, but one of the questions which came through the webinar as well. And after what we've seen so far, from the end of 2025 now into 2026, and the number of cases that we've had, and thankfully the slowing, and again touching some wood, we are still seeing the odd one popping up. What is the outlook for the future for this year and moving into the next? And I fully understand, Richard, you've not got a crystal ball, but from your side of things, how are we looking, and what should we be prepared for?
Still slightly early days. with what's happening. I mean, at the moment, week on week, we are now seeing the number of wild bird positive cases that we detect through the wild bird surveillance scheme, which is obviously very passive surveillance. It's dependent on what members of the public see and then phone in for them to get collected. Those numbers are coming down. At the moment, there are still cases going on in Europe, so the Germany, the Netherlands, Belgium over there. But at this point in the year, we wouldn't be expecting any more of those birds coming over here. Birds here are going to be looking to go the other way. They're going to go back to their breeding grounds. You can't really predict it, but some of them, there will be birds going from inland overwintering sites heading north in particular. So there may, with that churn and that movement going further north, they could take some disease with them. So I wouldn't want to rule out entirely that we could get further cases. The other major thing is just really hoping it doesn't get into the seabirds again, as it has done, a couple of seasons previously, where we had that oversummering effect, that it got into seabird populations and that just maintained it. And we had a kind of a grumbling ongoing of cases with seabirds coming inland, foraging and whatever, potentially bringing contamination. We had a grumble of cases going on over the summer. We never quite had a gap that we would, prior to 2020, we wouldn't really be expecting to see disease in the summer. It was very much an autumn winter time problem, but that has obviously changed just with the weight of infection, the severity of the virus, and the massive involvement of wild birds in particular. So I don't want to jinx anything, make any predictions, but as it stands at the moment, hopefully things are starting to look a bit better. And as I say, with the warmer weather, drier weather, more ultraviolet light, that hopefully will reduce the amount of virus sitting in the environment going forwards. But again, we're not out of the woods by any means, so keeping up the biosecurity is absolutely key. You can't let your guard down, because it could happen. One single lapse, somebody forgets to do something, it's raining and they run inside the shed, that can be enough. And as I said, if it infects just one bird within a matter of days, it's going throughout the rest of them. So
well, thank you very much for that, Richard. I mean, I do have a wooden desk and I do sit with my hand on it all day, and I have learnt not to open my mouth when I'm asked about this situation, because it tends to go the other way. So I am touching a lot of wood. Now, before we do finish up here, is there anything else you would like to say to the listeners?
The only thing to mention, people may have seen it, it was press releases went out yesterday. They're on the gov.uk DEFRA sites. Some potentially good news: they have started a vaccination trial in turkeys. So the day-olds, to my understanding, were getting vaccinated yesterday. So I think that's quite an exciting thing to look forward to. As I say, I'd refer people to the website. There's a bit more information being released, but that's certainly something to keep an eye on as we go forward, and hopefully it may. I mean, we don't know yet. It's early days. We know other countries have been doing various vaccine trials in different species. We've still had problems in places in like France, where they've had cases in vaccinated ducks. So again, vaccination isn't necessarily a silver bullet, but it's potentially another tool in the armory. But as I say, from our perspective, it's very early days, and we'll be very eagerly looking forward to the outcomes and see where we go with that.
Well, thank you very much, Richard. And I think a lot of the industry will be looking at that with wide eyes to see the outcomes. So
as I say, it's very, very early days, and it is a trial. So I wouldn't want to get people's hopes up that much, but it is. I think it's an important first step for us.
Of course, and if we don't make the step, then we'll never know the outcome. So I'd like to thank you for your time, Richard, and thanks to the listeners for joining and following on from our Biosecurity Now webinar. A huge thank you to you, Richard, for sharing your experience and those very informative insights into the realities of disease risk and on-farm biosecurity. With outbreaks slowing but still continuing to challenge farms across the country, every measure matters, from planning ahead to maintaining consistent on-farm biosecurity. If you found this discussion useful, be sure to subscribe so you never miss an episode. We'll continue to bring expert advice, as we've done today with Richard, to help protect your livestock and strengthen your farm's resilience. Thank you very much, everybody.
Thank you.